Welcome all, welcome to this AimExcellence presentation. After uploading the video day before yesterday, we have got tremendous responses from your side, and that is why we are uploading one particular MCQ that have been asked in the examination, and the pictorial of that particular MCQ most probably have not been asked in the examination. That is why we are giving you the picture of that particular MCQ, and we are also giving the clinical scenario. The question can in future can come up with a clinical scenario also. That is, we are giving the clinical scenario. Now, a 27-year-old male, Manoj, had fever and positive cardiac sign. After CSF examination, diagnosis of bacterial meningitis is made. He is treated and is discharged from the hospital. During follow-up examination, he complained of numbness in little finger and lateral border of feet. After MRI, diagnosis of coalescent arachnoiditis is made. The sign in MRI is most commonly seen in. There are three types: type 1, type 2, type 3 are all seen in all equally. So there is a clinical sign that have been mentioned in the examination that have been shown in this particular MRI. This is a T2 MRI image, and this hyper intense lesion is known as empty THECAL SAC sign. Empty THECAL SAC sign. Now we could have given the answer where in which of type of coalescent arachnoiditis it is seen. So you most probably know by now it is seen in cases of coalescent arachnoiditis. Here this particular sign is seen. It is axial T2 MRI. T2 MRI. It is done in level L5. Why it is done in L5? Because spinal cord is not there, so nerve roots can be easily visible. It is actually seen in the normal case. It is actually freely circulating in the CSF. But in cases of coalescent arachnoiditis, there are three types. Number 1, type 1, the nerve roots are clumped with each other. Nerve roots are clumped with each other. In type 2, the nerve roots are clumped with theca. And this empty THECAL SAC sign, is actually best visible in type 2, because in the type 3 nerve root also clumped with theca, but it is actually get presented centrally. Together centrally as one single cord. So the answer of this particular question is this one, type 2, where the empty THECAL SAC sign is seen. This is taking forward the topic that have been asked. because the future questions may not be the similar one, and few important points regarding coalescent arachnoiditis. The etiology, one of the main etiologies is meningitis, as it is being seen in this particular patient with having fever and positive cardiac sign. Positive cardiac sign. Also seen in cases of intracerebral hemorrhage. In cases of use of intrathecal steroid, intrathecal steroid, administering of certain anesthetic drugs in cases of, particularly in cases of spinal anesthesia, and also in case after surgery. Sadly, there is no cure of this particular condition. The condition will persist. No cure. Patient will continue with the numbness here, and also in certain cases it can be a tingling sensation, particularly if there is calcification out here. There are very few cases where calcification is seen. So this is the particular case. This is coalescent arachnoiditis, and it is empty thecal sac sign. And if you like this particular presentation, continue to be with us. We will not be able to upload this video question answer discussion with so much frequency in future, because right now we are thinking a few other avenues also, but obviously we are going to stay connected with you, and hopefully our presentation will help you in upcoming examination also. Be with us, stay with us. Hopefully our uploads will help you in getting your seats, PG seats, and also understanding the medicine a little bit better. If we able to facilitate that process, we'll really consider that our effort is actually serve the purpose. Thank you for being with us. Thank you for supporting us, and we strongly recommend you to follow YouTube channel. Maybe in YouTube channel we are thinking of uploading certain important aspects in our presentation in YouTube channel only in the upcoming days. So it is better that you stay as a subscriber in our YouTube channel too, as you are being in our Facebook channel and the Twitter. So thanks for being with us, and really value your support. Thank you.